Hey guys, so today we are gonna learn about the Wilms tumor. Okay, so this Wilms tumor, it is also known as nephroblastoma. Okay, so it occurs in age group 2 to 5 years. Okay, remember this, 2 to 5 years of age group. Now the precursor cells are, they are the nephrogenic rest cells. So these are the precursor cells. So what will happen is, so there is genetic alterations, means they are germline mutations of the tumor suppressor gene, that is Wilms tumor 1, WT1 and WT genes. So because of these genetic alterations, these nephrogenic rest cell, they will proliferate more and more in number and they will cause tumor. Okay, then this tumor is located in the one of the poles of the kidney. So either it can be upper pore or it can be lower pore, either here or here. Okay, this is located on the one of the poles of the kidney. Now when we come to the clinical features, so here it is a triad. So the clinical features contains a triad, that is mass, fever, and it is the hematuria. So this is the main triad that is seen in the Wilms tumor. Remember this very perfectly, okay, because they can ask you an MCQ on this also. So it is a mass, hematuria and fever. So this is the triad, and along with that we told mass. No, so mass is also the common presentation in the Wilms tumor. So how is the mass? Remember, the mass is smooth, mobile, lobular, located in the loin, and it moves with the respiration. Okay, it will move with the respiration, and it is bimanually palpable, ballotable, and there is a dullness in the renal angle. In the renal angle you will also see the dullness, and remember, it will does not cross the midline. Okay, it does not cross the midline. Okay, smooth, mobile, lobular, in the loin, moves with respiration, bimanually palpable and ballotable, dullness in the renal angle, and it does not cross the midline. So this is the main things in the clinical features that you need to remember. Okay, now just now I told you fever, hematuria, no? So fever, why will this fever occur? Because it will occur because of the tumor necrosis. In the tumor, if there is necrosis that occurs in the tumor, because of this necrosis you are gonna see the fever. And the hematuria means it signifies the rupture of the tumor. Okay, if this is the tumor contains nephrogenic rest cells. No, if there is rupture, okay, if there is rupture in these cells, and this rupture, obviously cells rupture means blood will release. Okay, so rupture in the tumor will rupture in the tumor will cause the hematuria. Okay, now hypertension, obviously kidney there are increasing cells, obviously renin secretion will be also increasing by the kidney. So because of there is increased renin secretion, there is hypertension. Okay, now coming to the investigations. In the investigations you are gonna do ultrasound abdomen, CT abdomen, renal angiography, x-ray of the abdomen, etc. And in the x-ray, this is the diagnostic feature. Remember, there is eggshell peripheral calcification. Okay, eggshell peripheral calcification, and this is the diagnostic feature that is seen in the x-ray. And here you can also do an MRI. Okay, now here comes the management. In the management, now I told you wait a minute, sorry. So now I told you there is a tumor in the kidney. Okay, so now if this is unilateral tumor, if this is the unilateral tumor, now this both kidneys are there, this one is the normal kidney, sorry, this one is the normal kidney, and this is the diseased kidney. Nephrectomy means this, you are going to remove this kidney. Okay, and next post operatively you are going to give a radiotherapy. This is done in the unilateral cases. Now in the bilateral cases, what you are going to do is, one is bilateral partial nephrectomy, or nephrectomy on the one side with partial nephrectomy on the other side. So here what it is, there is now these are the two kidneys. Okay, now you have bilateral this. So partial nephrectomy is only this, the diseased part you are gonna remove. Okay, you are gonna remove this diseased part and you are gonna left this normal kidney. Or what you are gonna do is, one side nephrectomy you are gonna do and other side partial nephrectomy. Means this total kidney you are gonna remove and this diseased kidney you are gonna remove, and this normal kidney you are gonna spare it. So this is also known as nephron sparing surgery. Okay, this is also known as nephron sparing surgery. Remember this. Okay, and now next is chemotherapy. In chemotherapy what you are gonna do is actinomycin D, vincristine and doxorubicin. Okay, and the prognosis is younger children, that is 2 years of age, have better prognosis. Above these years, as the age increases, the prognosis goes on decreasing. So this is about the Wilms tumor. Remember this, guys. Thank you for watching. Please subscribe.